we know how dinosaurs procreated, yet you can't tell me how I am unable to get pregnant. Fertility, obviously a common misconception is that, well, if your mom was fertile, of course you're going to be fertile. It's just like, no, that definitely is not how that works.
Welcome to the I Decide Darlings podcast. I'm Erin.
And I'm Lisa. We are moms, wives, best friends, entrepreneurs, and authors of the book, I Decide, the happy little guide to living your best life. Pull up a chair, grab a glass of wine, and get ready to talk all things health, success, loss, money, family, and everything in between. These two besties won't leave anything off the table.
So get ready to laugh, cry, hear the tips, tools, and stories to give you the success you crave, the life you adore, and the future you deserve. You are listening to the I Decide podcast. Hello, everybody, and welcome back to the I Decide Darlings podcast. We have some fun stuff to talk about today. And as always, I'm Erin Lopez.
And I'm Lisa Cox. Welcome.
Welcome, welcome. You guys, it's like sunny today in Houston. And so I have this like funny glare. If you're watching this on YouTube later, I'm like trying to get out of the glare. Sidebar, right? Well, speaking of Texas, I have the lovely pleasure of introducing our guest with the I Decide Darlings podcast today, who is not far up the road from us up in Dallas. And Dr. Roxanne Pero graduated from Louisiana State University, LSU, for all of my Texas friends out there. That is a big deal. Woo. Receiving her medical degree from Louisiana State University Health Sciences Center of New Orleans. Subsequently completed her residency at the University of Texas in Southwestern Parkland Memorial Hospital in Dallas, where she resides. She completed her board certification for the American College of Obstetrics and Gynecology. She completed 12 years of private practice in the field of obstetrics, gynecology, and infertility, where she cared for thousands of amazing women and helped so many resilient families through high-risk pregnancies. Love that. Mm-hmm. For the last 3 years, she had stepped out of the hospital and into the holistic space. We're going to talk all about that. Mm-hmm. She is a diplomat and fellow of the American College of Lifestyle Medicine, a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions. She is board certified in functional medicine through the Institute of Functional Medicine. She currently has a thriving practice in Dallas, Texas. And guys, I love this part. She dishes out modern medicine facts with evidence-based holistic hacks. Okay, Roxanne, that was a mouthful because you're amazing.
Yes, truly.
And there was so much that I just fumbled over because of all of your accolades and everything you've done. But my best and favorite part was the end about, your holistic hack. So Roxanne, Dr. Pero, thank you for joining us on the I Decide Darlings podcast.
Oh, thank you, Erin and Lisa. Thank you guys for having me. I feel very honored to be here, and I'm excited to talk to you today.
We're excited as well. Well, I read a laundry list of your amazingness. But we here at the I Decide Darlings, we want to know who Dr. Roxanne Pero is. So we'd love to hear a little bit about like your background. Like, how did you get into the field of doctor? I personally am excited because I have 2 girls that may go down that path. But we'd love for our audience to hear how you got to be where you are today.
Yeah, absolutely. So, I think most doctors have that background where one of their parents were doctors or in the medical profession. And so that was mine. I come from a long lineage of what I like to say are healers. My great-grandfather was a healer. My grandfather was a healer. And in Louisiana, that, sometimes translates into a voodoo doctor. But before they really had, or holistic medicine was trendy, that's what a voodoo doctor or healer in Louisiana did. And so my dad became a internal medicine physician. And my sister became a doctor as well. And that just seemed like what I was supposed to do, right? Um, but I kind of fought it when I went to medical school. I thought I started my major in English. And then before I knew it, it just wasn't challenging. And like so many things in my life now looking back, I'm just like, yeah, I've never chose the easy road for so many things. So I ended up changing my major to pre-med, and that's how I got started. So it was all family influence. My dad is still a practicing internal medicine physician in Baton Rouge. My older sister does pulmonary critical care. We've got so many doctors in our family. So we really need a dentist, though. I mean, everybody needs a dentist in
No, I'm kind of thinking, like, what are you missing? Like, you kind of need the dentist, cosmetics, maybe? I don't know. Like,
right?
I
And
I
to be
just want to be a
honest,
part of your family.
right. Well, I'm one of 10. So I, have a lot of brothers and sisters. And so,
Stop it. Okay, wait.
right.
We just need to know again because we want to like become your friend. How many brothers, how many sisters?
I have 6 brothers and there's 4 girls.
And
Oh
where do
my
you
gosh.
land?
Yeah. I'm third from the oldest. So it ranges, it's a 20-year span.
Okay.
So it's amazing. So, I mean,
Oh
you
my
talk about,
gosh, I love that.
all the things that I specialize in, fertility, obviously a common misconception is that, well, if your mom was fertile, of course you're going to be fertile. And it's just like, no, that definitely is not how that
Mhm.
works. So,
Mhm. And that is part of your story and your journey because you went down the route of infertility, correct? Especially after
absolutely.
having 9 siblings.
Right,
You're
right.
right.
So again, another thing that I was just like dead set. I was gonna either do ear, nose, and throat, or I was gonna do dermatology, but I was not gonna do OB-GYN. And I did my rotation and I just fell in love with it. And
Mm.
when you really think about it, what is there not to love about literally taking care of someone that's just like you, or someone that's just like your sister or your mother?
Mhm.
Just beautiful relationships that get formed, and then just in the vulnerability of delivering someone else's child, just, I mean, a connection just gets made that is, I mean, without words, it's just hard to really describe. So but yeah, loved
Mm.
delivering babies, and I'm very sad that I don't do it anymore, but that was kind of part of, my deciding moments for my career,
Mhm.
for sure. So
So the whole doctor to healer. I'm also a child of doctors. Grandfather was head of surgeons at Memorial Hospital, and my dad was oral maxillofacial. My grandmother was a nurse. We were just all medical family, and they um they think anything, even including supplements, are kind of woo woo. And
right.
so for you to go, I mean, I think that to me is a big swing. And I love it. I love what you're doing. And
Mm.
I think it's very, very smart. I love seeing that there's more of that actually happening right now. Because I think it's important that you have your degree as a doctor, but that you can also truly find the source of things and be a healer. And so, but isn't that like kind of a crazy swing? I mean, I know it's almost like they're halfway against each other all the time.
Exactly. And that's where I love to be, is in that space in between, which
Mhm.
I am hopeful and optimistic that more people will join me in that space, because
Mm.
that's really what women especially need, right? Just again, so much of the gaslighting, so much of patient advocacy that is being brought out to light now. And women are saying, look, I mean, I don't want just one option. I don't want you to
Mhm.
just, I want to be a equal participant in my medical care and management. And so I love that. And everything about me getting to this point was a huge unfolding, right? It didn't happen
Mhm.
overnight, but yeah, it kind of started with the fertility journey, the expectation that I was going to be able to get pregnant, no problem, because I'm one of 10.
Mhm.
And then when it didn't start happening, and going to fertility doctors and understanding that there's something called unexplained infertility, which at the time was like, okay, it's unexplained. Let's just go to IVF. But then really starting to work through it as I went through 5 years of not being able to get pregnant. Yeah. It's no fun when your REI, your fertility doctor, who knows you're an OB-GYN, tells you that you're his toughest case, right? But failed IVF, failed artificial inseminations. And, you just start looking back and you're like, okay, we know how dinosaurs procreated, yet you can't tell me how I am unable to get pregnant. There's just so much in that just kind of is a light bulb moment to say, we're not doing things right for women in the current conventional healthcare space.
Do you think that was that a huge turning point for you when you decided to go that holistic route, or was that part of your, I mean, obviously part of your journey, but was there a moment that you literally said, I have to make a turn?
Yes. So it wasn't the fertility. So, I was very much in the conventional space then. IVF, seemed like, the no-brainer. But again, we went through a lot of failed IVFs before we conceived my first when I delivered him when I was 36 years old. And, then 38, we had twins through a frozen embryo transfer IVF cycle. And it really wasn't until about 5 years ago when things just really, really started impacting. I think when you're in the medical field, especially when you're in acute care settings, emergency room, OB-GYN, if you're taking care of sick people, like in oncology, you deal with these shared death experiences, these shared loss experiences, and you don't really address them. You kind of just, okay, yeah, I had a woman who had a stillbirth. You take care of the patient, and you don't deal with what it has done to impact you emotionally, which if you're a human being, it will, and it does, but you have to move on to the next patient. You don't have time to deal with your own feelings. And so, about 5 years ago, I had a patient who was 25 years old, who had a genetic predisposition to breast cancer and developed breast cancer at age 23. She had surgery, did chemo. And then at age 25, when everybody told her it wasn't likely she was going to be able to get pregnant, she got pregnant. So of course she was over the moon. She was so happy. She had a great pregnancy. And then she started to have lung issues. And we thought, well, this is probably just an upper respiratory infection, gave her some antibiotics, didn't quite do it. We sent her for, a CT scan of her lungs. At that time, she was about 36 or 37 weeks pregnant, and full recurrence of her cancer lungs.
Oh my gosh.
Yeah. So I had the hard news of telling a 25-year-old who was about to deliver her baby that her cancer had recurred. And it tears me up because, I'm no longer sad about it, but I think it's just a testament to the legacy that she has created for me. One, to be an advocate for breast cancer, but two, to speak the truth, that again, conventional healthcare is failing women. So we went on to deliver her baby that day, and 7 days later she passed away.
Roxanne.
Yeah. So in that same year, I was doing call. I had gotten into the hospital early, and I had a patient who the night before had texted me, because I'm a huge empath, as you can see, and I give my phone number to many of my patients.
I saw that.
Sometimes don't even have to ask. Yeah, they don't even have to ask. I'm just freely giving it to them, and none of them have ever disrespected that. So I had a patient who texted me and said that she was having bleeding. She was 23 weeks pregnant, and so we admitted her to the hospital. I went in that morning to check on her, And literally within 5 minutes of me getting there, there was a phone call saying that the bleeding had restarted. And so I went up to the floor and, you know, it was an acute situation, and 23 weeks is usually the time where it's touch and go. You don't know if the baby is going to survive, and if the baby does survive, there is an increased risk of cerebral palsy, brain damage. And so you do have to have that hard conversation with patients. Hey, do you want me to now do everything possible to save your baby's life? And so I asked her and she said, absolutely. So we started going, and we called for the elevator and it wouldn't come. And we called for the elevator and it wouldn't come. And literally, I mean, not to be graphic, but it was an emergency situation, the amount of bleeding that she was having, not just for her baby's life, but for her life. Her husband was there. I had 2 nurses with me. And I said, if we can't get the elevator to come, we're going to have to go to the other side, which is not the patient bedside. Well, on the other side, you can't fit a bed in there. So we didn't have a wheelchair at the time. So I literally picked her up and we carried her in the elevator. Got out of the elevator. We have a hallway to walk to get to the operating room, and she's bleeding enough that we had to, her husband tripped and fell. The other 2 nurses weren't able to carry her. And when I tell you that this was the moment that I knew that there was something beyond conventional medicine, I am carrying a woman that weighs more than me on my own down a hallway, and I literally saw what could be angels around me. And I went into that room, that operating room, put her on the bed, scrubbed in, we delivered her baby, and just a couple of months ago, she sent me, a picture of her 5-year-old that is perfectly healthy, is a miracle baby. And that was my unfolding time period. That was me recognizing that I couldn't continue to do the same old thing, seeing 30 patients a day, doing their pap smear and never once talking to them about the things that really matter, like relationships, like stress, like job satisfaction, like sleep, nutrition, all of those things. And so, it ended up being then a lot the following year with an adoption of our 4th child. And at that point, things got to the point where it just I wasn't able to see patients like I should have, in the mindset that I was in. So I walked away from my practice of 11 years without knowing what I was going to do.
Oh, wow. Oh, Roxanne. Oh my gosh. What a beautiful story.
I'm kind of speechless.
I
I'm
know.
not gonna lie.
Well,
I should have warned you guys about Kleenex.
I know. It took my breath away hearing what you went through, and I'm so grateful. I think my mind goes to a couple different things. One of the things is just being in the medical field, like you are, either side of it, to me, how you can treat patients and not have emotions, or not that you weren't saying you didn't have emotions, but you had to move from that patient who just went through a horrific event, I'm sure that same day, to the next one. And that to me is like a superpower. And I personally, who do not feel like I have that, am so grateful for people like you that are in whichever side of the medical type of care, either Western medicine or holistic medicine. But okay, so with that being said,
I have to say really quickly, you're the angel too, Roxanne. I mean, hearing that story, and then you're a great storyteller because again, to be there, I can't imagine. But when you said that, I kept thinking, like, visualizing it, and like I just kept thinking, you're such an angel in a lot of ways. And then you said that, I thought, hopefully you're part of that God's work too of the angels all around. So thank you for sharing that. I can't imagine. Sorry, Lisa.
No, don't be sorry. You're right. I love that. And we do believe and Aaron and I talk about this all the time on this podcast, and in our book, we talked about how everything happens in our lives for a reason that take us to our next meaning and our next purpose. And so it definitely feels like what happened in your life and during your fourth child's the adoption process, and that you had to quit your practice of 11 years. I'm really excited to hear more about what, we want to know more for the audience, what you're doing now. But before we go there, let's go back a little bit to the perimenopause and that, because that's something that Erin and I can both relate to. I am post now, but when I went to my doctor, my Western medical doctor, when I was feeling everything at 48 that was terrifying me, the hot flashes, I couldn't think straight. I would lose my train of thought, and I'm a trainer and a coach. And so I'd be in the middle of doing a presentation and all of a sudden a hot flash would come and it would take me out of my game for 30 seconds, it felt like, or a minute. And so all of that. And then plus my brain, I had the brain fog. I just didn't feel like myself. I started to gain weight through my midsection. I felt ugly. It was such a crazy time. And my doctor just looked at me and said, and I'm sorry if my doctor listens to this podcast, but he basically looked at me and said, every woman goes through it. You'll be fine. That is what he told me. Every woman goes through it. You'll be fine. And, I felt like even during this time, I was being difficult at home, and with my husband, I was like causing fights and, all this stuff that wasn't a part of our MO, wasn't a part of who we are. And I felt crazy, Roxanne. And I know you understand this. I see you shaking your head. And I am so grateful that I found a woman doctor in our town that was, that would take my blood and that would look at my blood and tell me the other things that we can do. So would you talk about that for a second? Because, like one question Erin wanted to ask, and I'm sorry if I'm saying your question, Erin, but like, when should women know that it is time to go seek help outside of the normal Western doctors?
Yeah, absolutely. Great question. I recently had a patient who had seen me at my Western conventional practice setting in the hospital. And I said, I'm glad to see you here, but I'm just kind of curious, why you're coming to see me versus just, going to my old practice. And she said, the last time I went in for my annual exam, for my physical, my yearly checkup, I walked in and I go to sign in, and there's a huge sign on the front desk window that says, for your annual exam, you are not allowed to talk to your doctor about. And it listed everything that you would likely want to talk to your doctor who you haven't seen in a year about. Mood swings.
Wow.
Okay, that's a red flag.
Yeah.
And that's the thing. Like, it's becoming more and more common to have your doctor at your annual physical say, hey, we really don't have time to talk about that. Let's get your pap smear done. And then maybe you can schedule a follow-up next. And that is such a huge problem. Okay. Women are dying from cardiovascular, heart disease, and from breast cancer. They're not dying from pap smears. Okay. Excuse me. They're not dying from pap smears. So we need to shift how we're actually talking to women, what we're talking to women about at these yearly physicals, because we're not doing them any justice by a heart exam, touching their breasts, doing the pelvic, and then sending them out the door. Okay. So I will talk to patients, by age 40, for sure, you should get an understanding of what is likely to come. Okay. I had a patient who, again, another former patient of mine who came back to see me. And she said that in looking at my Instagram, and I had posted about perimenopause symptoms, it was just a light bulb moment. She was like, oh my goodness, all of these things are going on. And she said, I feel like my mood swings are crazy. I mean, I'm still a great mom to my baby. And I was like, let me guess, you're a great mom, but you're not doing too well in the wife department. And she was like, how did you know? I was like, because this is perimenopause, right? This is
Yeah.
what I went through exactly. You
Are
just
you
don't.
pointing at me too, Lisa? I'm just kidding. Oh, she's pointing at me. Okay. All right. Just making sure. Remember, we're all friends here.
I'm teasing.
Okay. Keep
Yeah.
going. No,
But
keep going because my pen and paper.
Perimenopause, you're told, is hot flashes, night sweats, and irregular periods. You're not told that it's like, rage and depression and anxiety and weight gain and insomnia and, vaginal dryness and dyspareunia and decreased libido. You're not told that it could be so many different things that are uniquely personal to each woman that's going through it. So yeah, when you have someone that says, oh, every woman goes through it. Well, not every woman goes through it in, a certain severity or in a certain state. Okay. I was at the Menopause Society conference recently, and I was talking about, I'm a medical advisor for a supplement company. And I was talking about my experience. Like every time someone would come up, I'd be like, well, I love these because for me in perimenopause, and they'd be like, well, what do you mean? You're in perimenopause? I'm like, well, I'm 45. Yeah, I'm experiencing XXXX. They're like, you don't look like you're in and I was like, yeah, because I've done it differently. Okay. I'm not my mom's perimenopause. Okay. It's nutrition, it's lifestyle, it's so many things, but most importantly, it's that recognition. I'm going through it. I need help. And if my conventional doctor is not going to help me, I need to find someone who will.
Okay. So, whoa. And that is me, but I also know that it's so many women. I mean, and I think that I know nothing compared to you, but there's no book for what age you have to be, what you're doing. And I think that's why it's so stinking confusing. I know that I'm in perimenopause. But what do you do? Besides continuously hear my husband tell me that I'm crazy, I mean, I think it's the matter of acknowledging this, that it is part of what we go through, everyone at different stages, everyone different, everything. But I think where most of us fumble is, what do I do?
Exactly.
Because a lot of us too, I mean, my OB is a male. I love him. He's amazing. But he doesn't ask me those questions. So it's kind of what do women do when they are noticing some of these hot flashes, night sweats, craziness, all of that? What is somebody listening to this, me, what do we do?
Yeah. So one, just like you said, it's about acknowledging that that's likely what's going on, is that you're having hormone shifts, and they're going to be different from 1 hour, 1 day, 1 month to the next. It's going to be a roller coaster. And then letting being vulnerable. And it's just like telling your husband that you're about to start your period, and it sucks to have to tell him that you're about to start your period, but giving them insight, giving the people around you insight into really what's going on is very, very helpful. Okay. And then, again, talking to your doctor, but a lot of women are scared that it's going to be, oh, well, all they're going to offer me is hormone replacement therapy. I'm scared about hormone replacement therapy. And so what do I do? Okay. There are many, many studies that have shown, again, the holistic space that I'm in, acupuncture, nutrition, different types of exercises like strength training and yoga, mindfulness, breath work. They have shown to improve symptoms related to perimenopause. Okay. And then, you get into the supplement, the herbal therapy world, things like black cohosh, ashwagandha, chaste tree, also known as vitex. Those are all, they don't impact estrogen receptors. You can safely use them without feeling like you are increasing your risk of breast cancer. They act on serotonin, dopamine, GABA receptors for a calming impact, helping with sleep. And then I definitely talk to women about the benefits of hormone replacement therapy, which if you're going to do it right, it really needs to be done in that perimenopausal transition to get the most health impacts. But having a serious conversation about the pros and cons of progesterone, estrogen, and testosterone.
So you're not against bioidenticals?
No, I love
No.
bioidentical.
Oh, so they saved my life. That's why I'm curious what your thoughts are. I mean, but we get one of the things that I felt good about it after doing my research is that she does my blood work every 4 months. I actually just got notified today it's time to do my blood work again. And so she can read where everything is. And so that made me feel safe. Am I correct in that she's seeing that I don't get too much of it? Because I want to talk next after this about breast cancer, because it is Breast Cancer Awareness Month. And I know we want to talk about that with you because you're such a huge advocate for it. And I love that. But like the bioidenticals, when she read my chart the first time, I was flatlined. I had 0 testosterone, 0 progesterone. Everything just looked nuts, she said. And she's like, no wonder you feel like you feel. I was practically bawling in her chair. And she said, I can make you feel so much better. And so that's when I started the bioidentical. But I've been religious on those blood tests and having her look at everything. And I'm also very in tune with my body. But I'm glad to hear you say that you're okay with that.
Yeah, absolutely. And here's where conventional and holistic, spaces are gonna find some divide. And definitions matter. So bioidentical doesn't equal compounded, okay? And conventional doctors absolutely hate compounded medications. And there's good reason for that. When you think about something that's compounded, it's being individually made right at that time. And there potentially could be user error as far as how much is being put into that compounded medication. So that's times where it is important to get your tests done on a regular basis. Again, conventional medicine will say, if I'm putting you on a prescription, still you can have bioidentical prescription hormone replacement therapy. They say I shouldn't need to check your hormone levels, especially when it comes to estrogen and progesterone. Testosterone is a little bit of a beast of its own because there's no FDA approved medication for testosterone replacement for women. So we do want to track those levels, regardless of if you're getting a non-FDA but still prescription testosterone replacement, or if you're getting a compounded formulation for that. But so I usually will kind of, again, meet patients where they want to be at. I have some patients that thrive on compounded body identical hormones. And I have others that we check their labs and it's not really moving the needle. It's not enough. And so we then transition to, again, a body identical gel or a patch that's a prescription. So.
Oh, okay. Okay. So that's a great explanation of the difference, because I think I'm actually on the compounded now that you say that. But I've been calling it bioidentical. And Erin, you're a similar situation, right?
I am, yes. So I do have, yes. I mean, and I have the gel.
Yes.
So, but again, these are all questions like, I mean, Lisa has been a wealth of information to me too, having been a few steps ahead of me in terms of all of this. Otherwise, I wouldn't know what questions to ask,
Right.
other than something ain't right,
Right.
So, I mean, I love, this is such a wealth of information because I don't think we don't have the right questions to ask. And therefore the answers are definitely not coming our way.
And so we also know to not keep scissors in our bathroom so we don't cut our bangs. And we know not to have any weapons close to our husbands when we're mad at them. And we, I mean, I say all of that so jokingly, but, it is a very hard time in women's lives. And if you're out there and you're listening and you feel, I spoke a little bit about it one time from one of my stage presentations, and I had so many people come up to me afterwards and they're like, I'm so glad to hear you say that you went through this time, because they say you don't represent that right now. And I'm like, well, thank you. I'm glad I don't, but I went through it majorly. Mm-hmm. And when I got to the other side of it, I felt like a new person. I felt like a different person again. And it was worth
Mhm.
the questions and worth doing your homework,
Mhm.
and talking to, a doctor like Dr. Roxanne Pero, or someone that can really, really dig deep with you and find answers and be your own advocate. I think that is so important. Now, Dr. Roxanne, let's talk about breast cancer awareness. I know that you are a huge advocate for it, and we wanted to make time to talk about that today. And I recently just went through that too. I just had to have a biopsy and go through all the scary thing, but I get my mammogram every single year. And I'm a huge believer in that. And I always try to get on my social media and remind women when I'm going for my appointment, don't forget your mammograms. But we want to hear what you can share with us about that.
Yeah. Well, the fact is that breast cancer cases are rising, which is just mind boggling, right? We have so many advances in Western medicine, and we're feeling women again. Our breast cancer cases should be dropping. The silver lining is that less women are dying of breast cancer. Okay. But you're still met with, so many breast cancer survivors still have that fear, still have that stigma. And so we need to just really try to do things that are going to eliminate and start to reduce that risk, that breast cancer rate. And so, prevention is huge, and I'm talking about prevention in nutrition and lifestyle. We know that the more alcohol you drink, the more risk you are of developing breast cancer. And alcohol intake in the United States is just such a norm for especially, middle-aged women. That's how we socialize, right? We don't know, how to go out with our friends without having alcohol be part of it. And if you're not drinking, someone's asking what's wrong with you, which, it's that shift needs to change, right? Oh, I'm so inspired by you, really should be what it is. It's not an easy thing to do, to socialize without alcohol. But so talking to women about how much are you drinking? Can you reduce that? Nutrition. So studies have shown fiber intake can help with estrogen excess clearance. Okay. That's a huge part of it. So are you getting 35 to 45 grams of fiber in? Start tracking. See what you're doing. Use your MyFitnessPal app. There's an easy app called Fiber Tracker, and then slowly work to increase that fiber intake. And then exercise. Sweating has been shown to help to detoxify excess estrogen. So that should always be a part. 20 to 30 minutes of your day, you need to prioritize self-care. That is one that you should not miss every day. And then, early detection. So we're not preventing breast cancer by doing mammograms, but we're doing early detection. And so again, that difference, that chasm between conventional and holistic medicine, where the holistic space vilifies mammography. They say, don't go get a mammogram. It increases your risk of radiation exposure. The fact is that we're getting exposed to radiation by walking outside our doors. Okay. We can't live in a bubble. And studies have shown that the risk associated with breast cancer from yearly mammograms is about 20 per 100,000 women. Okay. And some people are like, well, I don't even want to be that 20, I don't want to be that. Well, you're making a decision to get in a car, you're more likely to die, from a car accident than you are, from a diagnosis of breast cancer now. So you've got to decide, do you have access to other modes of early detection screening other than mammogram? Will your insurance pay for a breast MRI? Do you know where to go and get one of these new ultrasounds that's supposed to be comparative to mammography? They're not in many states right now. So what do you have access to? If all that you have access to is a mammogram that your insurance will cover, get the mammogram. Okay. And I still advocate for self breast exams too. I think hugely important. That's been downplayed in the Cancer Society's recommendations to do your self breast exam. But most of my patients that have been diagnosed with breast cancer have found it on their own.
Wow.
That's so interesting to hear, because my doctor does tell me, don't worry about it anymore.
Yeah.
And again, I'm 48 years old. I mean, we've been told that our entire lives, that, and I agree with you that I think women are so hopefully in tune with ourselves that the second you feel something, it's a
Mhm.
flag, and women more than men were probably going to act upon it,
Mm-hmm.
Exactly.
So I
But
appreciate you
that's,
saying that because
yeah.
I do think it's,
Yeah, I mean,
yeah,
that's a
yeah.
very good example of how in Western medicine, how we take it off of patients' plates. We say, don't worry about this, don't worry about that. We'll take care of it. If you get breast cancer, we'll take care of it. There's no talk about
Mhm.
prevention, and we really need to change the narrative for that.
Yeah.
Would you say that the same reasons that you give us that we need to be working on for prevention are the same exact reasons why it's on the rise? Because of so bad nutrition, so much alcohol. Is that the reason why it's on the rise, or is there an atmospheric reason?
I think toxin exposure is huge. We
Mhm.
know that PCBs, phthalates increase our risk of cancer. And those are hard things to avoid. Again, unless you're living in a bubble. So how do you live your life without the fear of every single thing potentially causing cancer? Well, it's an 80-20, right? In all things, you'd really have to try to do the most good for your body, but understand that, you're still allowed and you still should enjoy this life that you're in.
Mhm.
I know we have to wrap up for time's sake, but I want to say one quick thing. Can you give us as women? So first of all, everyone needs to go to your Instagram because it's fabulous and see
Thanks.
who we're talking to if you're not watching us on YouTube because you're so beautiful and so smart. And but I love the fact that you put a lot of focus or on your Instagram at least on healthy makeup and to make us women think about what we're putting on our skin, on our bodies, all of that, as well as everything else that you talk and share about on there. Do you have a quick tip or two that you could teach us today about healthy makeup that we can start doing today? Like what we can look for,
Absolutely.
or do you mind? Thank you.
Absolutely. Yes, I'm obsessed. I'm obsessed with makeup. Even more obsessed with clean makeup. And I usually tell patients, who are, I'll talk to them about, a supplement regimen, and they'll be like, well, I really don't want to take, 5 or 6 supplements. And then I go through, I was like, okay, well, how about we do this? Let's start with your morning routine. Okay. Let's write down how many things you put on your body head to toe. I guarantee you that's going to be more than 5 or 6 things. Okay. So, do you
Mhm.
care more about your outside appearance or your inside? Right. And everything that you do inside is going to translate into a beautiful glow, moisturized skin on the outside. So, that's number one. And then number two, I tell patients, of all the things that you're exposing your body to that you can't control, air quality, sometimes even filtered water has, toxins and chemicals in it. What you decide to put on your body is a huge impact that you can do for yourself, for your health. Okay. So my clean makeup go-tos, I would say there's tubes and organics, and well people are probably, for me, the most consistent for clean makeup products. But I've always kind of been like, oh, I want to go in the store and I want to try it. I don't know if you guys are that kind of,
Yes.
yeah.
Yeah.
So I don't always love getting things in the mail, and then I'm just like, this is like not what I thought it was, and then you have to return
Mhm.
it and all that. But so for Sephora, if you're thinking about going into some place like Sephora, yeah, Kosas is a great one, but I still
Mhm.
Hostess.
encourage
Yep.
patients to scan the products. Okay. And Yuka, YUKA, is a great app that I love because they have a huge database. It's totally free. You can't upgrade, but you don't need the upgrade. You can do the free. And you just scan the products. Kosas has great eyebrow pencils. They have great eyeliners, eyeshadows. Some of their lip products are not as well rated. RMS Beauty is one that some support stores have and some don't. Just very good quality products. Their setting powder is talc-free and just is beautiful. It's not heavy, not cakey. When it comes to foundations, concealers, you'd be surprised. Charlotte Tilbury actually has a few that are high performing.
Wow.
Yeah, and get good ratings on the Yuka app. And then lips. So again, surprisingly, Fenty Beauty, Rihanna's line, has some of their matte lipsticks that have 90 out of 100 ratings. So those are fun to do.
Wow.
Yeah. So there's
What about a dry shampoo recommendation? I know dry shampoos are very toxic.
Oh, really?
Yes.
Oh, I mean,
very toxic. So what do we do for that, Roxanne?
Yeah. So Vegamour, Vegamour has a dry shampoo spray that I've rated before, which is pretty decent. So, but yeah, you're right. A lot of dry shampoos just don't.
I just threw all mine away when I read about that. I just threw them all in the trash.
Yeah.
Okay, well, as a mom of 2 teenage daughters, this is priceless information.
Absolutely.
Because my bill at Sephora is astronomical. So
yeah. Tell them, get the app, scan before you buy. So
yeah, they love Kosas. So I was happy to hear that one.
Awesome.
Well, Roxanne, I just want to say, you know what? We need this real talk in our lives.
Yeah.
Women need it. Girlfriends need it. We need to take the time with each other and stop talking about what's on social media and talk about the real stuff and the real deal. And so we appreciate your honesty today and sharing with us on all of these very important women topics. And so I could literally ask you 1,000 more questions.
I know. I want to come back on.
I was thinking,
we will.
I feel like we do need to have her back on, and like I would love to do like a toxin talk, and like I want to know what you take every day. Like I have so many more questions, and I know Lisa. Yeah. Lisa's gonna come with like her makeup bag and be like, "What about this? What about that?"
Well, let's definitely schedule that and get you back on. But because we really did kind of just slightly skim over really important things that we could probably spend a bunch more episodes on. So we would love that with you, Roxanne. And thank you for your time today. You are just incredible.
Yeah.
Oh, thank you, ladies. I appreciate it. It was fun.
Wow. We just want to thank you. I've learned so much this time that we've spent together. You are just really such an angel. Thank you for what you are doing and pouring into us today on the I Decide Darlings. Ladies, we know that you heard something today that resonated with you or somebody else that you may know. So share this out. I know I'm going to go back and listen to it again, and we'll be back with Dr. Roxanne Pero here pretty soon. But thank you for listening to the I Decide Darlings podcast, and we will be back soon.
See you soon.
You've been listening to the I Decide Darlings podcast. If this podcast touched your heart, please share it with your friends and family right after you subscribe yourself.
Don't forget to head over to iDecideBook.com and grab a copy of our favorite book and daily journal. As always, thank you for being here, and we can't wait for you to hear our next episode.